Hi there, Dr. Rajeev Kapoor, back with you with another video. And this video is about how to manage patients with rectal cancer, which is located in the lower half of the rectum or near the back passage. I'm just going to discuss the surgical prospects in these patients because this can at times be a little bothersome for a patient to when he or she gets to know that the tumor is located in the lower half near the sphincter and that sphincter has to be removed. So what happens when a patient has a tumor near the sphincters, that is near the back passage, and the sphincter which controls our continence has to be removed? Then these patients will end up requiring a permanent colostomy or a permanent stoma on the abdominal wall. It means that we will remove the entire rectum, including the back passage, and our stools will pass. We'll make an opening in the abdominal wall and put a bag there, and our stools will pass into the bag, and that's called a stoma or a colostomy. It will be permanent because in surgical management of cancer, we need to have normal margins around the tumor about the intestine which we remove or the rectum which we remove, and thus the sphincters have to be sacrificed. So these patients will, of course, with the latest equipment available, innovative stapling devices available, we can conserve the sphincter in very low cancers. But if the sphincter has to be sacrificed, these patients will get up getting a end colostomy or a permanent stoma. This, of course, post-surgery, there is a counselor, a stoma therapist who will take them through how to manage life with a permanent stoma. And trust me, patients have gone on to have babies, they have normal sex, they go to work, and people don't even get to know that they have a permanent stoma. We have techniques where we clean that stoma in the morning, and then these patients do not even have to wear a bag throughout the day. There's more to it, but then in short, patients with low rectum, if we cannot conserve the sphincters, then they will end up getting a permanent stoma. My next video will deal about what are the various methods of doing surgery for rectal cancer. Thank you.